Leaders with the Montana VA say they're confident they can meet the primary care needs of veterans despite some current vacancies. MTN's Jonathan Ambarian takes a closer look at the agency's current staffing situation.
Montana VA leaders say they've received a number of questions about vacancies among their primary care providers.
There is a nationwide shortage of primary care providers, and being in a rural state like Montana, that can be more significant.
They say they aren't at full staffing levels, but they are still able to provide the services veterans need. In order to fully care for the nearly 50,000 veterans across the state, leaders say they need the equivalent of 37 full-time providers. Currently, they have just over 33 on hand. That includes some temporary providers and others providing services remotely through telehealth. At Fort Harrison, the VA wants to have 6 full-time care providers. They currently have 3, plus 1 temporary provider and 2 working part-time. They say some have recently retired or been reassigned, but replacements will soon start work.
We've got about a 2-month period where a couple of people are having changes in their work tour or retiring, and that could be perceived as being, like, oh my goodness, there are 2 or 3 people leaving at the same time.
Leaders say 8 providers plan to leave or reduce their hours, but 10 more are scheduled to join by May. They say they're confident the staffing situation will continue to improve.
I just want to reassure our veterans that we're here, we're not going anywhere, we're doing a good job, and that there isn't a shortage and there isn't any reason to be fearful that their care won't continue as it has been.
Jonathan Ambarian, MTN News, Helena.
VA leaders say they currently have 2 full-time vacancies without a known replacement, including one at Fort Harrison. They say they're actively recruiting to fill those openings.